Hello, I am Janelle. I'm going to be performing a chest and cardiac assessment today. First, I'm going to scan the room to show that there are no notes, note cards, or cheat sheets. Okay. And before I start the assessment, I'm going to check the patient's charts and doctor's orders. Then I'm going to provide for patient privacy by closing a curtain, or in this case, I shut the door. Then I'm going to perform hand hygiene. And then I'm going to make sure I have the right patient by two identifiers. Your wrist, please. Can you tell me your full name?
Stephen John Remick.
Date of birth?
12/13/1995.
And do you know where you are?
Look here.
Okay. My patient's LOC is +3. And as I begin my exam, I'm going to be checking my patient's skin, his color, looking for lesions, anything like that. His skin does appear to be true to ethnicity. I do not see any visible lesions or masses. His hair is evenly distributed, it's thick, it's fine, or it's smooth, which is a good finding. It seems very healthy. Now I'm going to check my patient's skin turgor and look for tenting. Tenting is it staying pinched. No signs of tenting, which is a good finding. If it were to tent, again, it would indicate dehydration. Okay, what brought you in today?
Checkup.
Checkup. Okay. Have you been in any pain?
No.
Any chest pain?
Nope.
Any coughing?
Nope.
Wheezing?
Nope.
Have you noticed any shortness of breath?
Nope.
Have you been more tired than usual?
No.
Okay. That's a good finding. First, I am going to inspect my patient's anterior chest. There's no masses or lesions. His skin is warm pink undertone. First, I'm going to percuss the chest between the second intercostal space and the fifth rib. Okay. There was no dullness, which is a good finding. Next, I am going to check my patient for jugular distension. Can you please lay down for me? And then I'm going to have you sit up at a 45-degree angle. Just balance yourself on your elbows. Okay. There does not appear, you can sit up now. There does not appear to be any jugular vein distension, which would be bulging of the jugular veins in his neck. If you were to notice that, that would indicate a backup of blood going into the superior vena cava, which would need to be looked at, maybe a blockage or the heart just not pumping sufficiently. Next, I'm going to palpate my patient's carotid arteries, but you are only going to palpate one at a time because if you do palpate two, then you could make the patient pass out by restricting too much blood flow. Okay. His carotid arteries are equal bilaterally +2. The beats are even, no extra beats in there. They do feel normal. Next, I'm going to auscultate 3 different spaces on his neck, the superior part of his cervical region, the mid-cervical, and then right above his clavicle. I'm going to be auscultating his carotid arteries on both sides. Okay, and when I do this, I'm going to have you inhale and then exhale completely and then hold, and then if you need to take a breath, go ahead and do so. Okay, go ahead. Go ahead and take a breath. Okay, then inhale and exhale completely. Okay, there was no abnormal sounds, no extra beats. My patient's pulse is very strong, which is a good finding. Next, I am going to auscultate my patient's anterior chest wall. First, I am going to start with the aortic landmark, which is the second intercostal space on the right. You can find it, find a notch, and then go over. Okay, next I'm going to go to the pulmonic landmark, which is going to be the second intercostal space on the right. Very good. And then I'm going to go down to Erb's point, which is going to be the third intercostal space on the right. And then I'm going to go down to the tricuspid point, which is going to be the fifth intercostal space on the left. And then next I'm going to check the mitral valve, the mitral landmark, which is going to be the fifth intercostal space, mid-clavicular line. Very good. Everything sounded very good. There's no extra beats. His beats were even. I did not hear any wheezing, any signs of rhonchi, no crackling. Can you please stand up for me? Next, I'm going to be looking for heaving or lifting near his apical pulse, which you will be looking for on the fifth intercostal space on the left side. There are no signs of heaving or lifting, which you would see, which could be an indicator of malnutrition or something else like a large heart or something like that. You can sit down. So that is a good finding. Can you turn around please for me? Okay, first I'm going to check my patient's tactile fremitus. Can you please repeat 99 as I move your hands on your back?
99, 99, 99, 99.
Okay, that was very good. As I went down, the vibrations did diminish. I did not hear. There's no crepitus heard or palpated. Next, I'm going to check the expansion. Okay. Take a big deep breath for me. Okay. Both of his ribs did expand equally, which is a very good finding. If one were to expand more so than the other one, that would be an abnormal finding and would need to be looked into. Okay, next I'm going to inspect his back, his posterior chest. There's no lesions or visible masses. His skin is evenly toned, pink with a pink undertone. Do you have any tenderness in your back? Okay. Now I'm going to percuss his back, starting from C7, going all the way down to T10. But to find T10, you would locate the bottom of his scapula, come in, which is and the scapula actually align with T8, so you go down 2 rib spaces, and they kind of go downwards, so you go down in a diagonal. Okay. There was no sign of dullness, which is a very good sign. It was pretty even throughout. It got a little bit more dull down here, which is a normal finding. Next, I'm going to auscultate in the same pattern. I'm going to be looking for any wheezing, rhonchi, crackling, anything like that. Take a deep breath, please. I did not hear any wheezing, which is a good finding, no crackling or signs of rhonchi. Go ahead and turn around for me. Now I'm going to inspect my patient's upper extremities. Okay. His skin is warm, it's moist, it's intact, hair is evenly distributed. There's no masses or lesions or any signs of abnormal findings. Now I'm going to check his capillary refill using the 3 middle fingers. All of his capillary refills were less than 3 seconds, which is a good finding. If they were 3 seconds or more, that would be abnormal, and it could indicate poor circulation or blood flow, and it would need to be looked into on one or both sides. There's also no signs of edema, which is a good finding. Can you lay down for me? Oh, wait, no. Hold on. First, I'm going to check my patient's radial pulses. Those are actually going to be equal bilaterally +1. His left one is a little bit stronger and it seems to be like half a beat ahead, but that is a normal finding. Now I'm going to check his brachial pulses. Again, those are going to be equal bilaterally +1. His left one does seem to be like half a beat ahead and a little bit stronger. Now, can you lay down for me? First, I'm going to start by observing his lower extremities. His skin is warm. Do you have any tenderness in your legs?
No.
Achy?
No.
The hair is evenly distributed, which is a good finding. You are going to check for a popliteal pulse. It's going to be right behind the kneecap. I actually was able to find that one. I'm going to check the left one. They're equal bilaterally +2. Then I'm going to go down to the tibialis. These ones are a little bit more faint, but they are equal bilaterally +2. And then you're going to go down to the dorsalis pedis. Okay. Those ones are much more faint, but they are equal bilaterally +2. Do you have any sharpness or dullness in your feet?
No.
Okay, so it's a good finding. Go ahead and sit up for me. Okay. Throughout this entire exam, I have looked at my patient's hair, the distribution, the evenness. I have also looked for lesions or masses, and I've also checked his skin color, which has remained a pink undertone throughout his entire thing. His facial expression has remained normal for this situation. His posture is great. He's sitting up straight. When he laid down and sat up for me, he didn't seem to need any accessory muscles to help him get up, which is a good finding. All his muscles are working. Overall, my patient did well. There were no abnormal findings.